Welcome back to your Pediatric Dentist channel Tiny Thick Talks. If you are new to this channel, subscribe the channel, and for details of this channel, visit the bio section, or you can also check out my first video. Sorry if there is any mistakes in videos or shorts. Today we will discuss the Scammon's growth curve. But first we have to understand what is differential growth. The human body does not grow at the same rate throughout life. At some age it grows faster and at some age it grows slower. So different organs grow at different rates, at a different amount, and at a different times, known as a differential growth. This concept is particularly significant in dentistry, especially in orthodontics and pediatric dentistry, as it impacts the development of the dentition and occlusion. How? In dentistry, the differential growth is observed in the development of the jaws and teeth. For instance, the maxilla and mandible may grow at different rates, leading to malocclusions. This is why orthodontic treatment often involves guiding the growth of the jaws to achieve proper occlusion. Coming to the Scammon's growth curve, the body tissues, namely lymphoid, general, genital, and neural, grow at different rates at different times. Upon analysis of the size of various parts and organs of the body, Scammon proposed that the growth of different tissues and systems could be summarized in 4 patterns of growth. These configurations, when plotted on a chart, represents the Scammon's growth curve. Starting with the general tissue. The general or body curve is particularly significant as it describes the overall growth pattern of the body and its primary components such as the bones, muscles, and organ systems. So general tissue involve the overall growth pattern of the body includes bone, muscle, and organ system. So first is a rapid growth phase, which is birth to 2 to 3 years. The initial phase of the growth from birth to about 2 to 3 years is characterized by a rapid increase in the size and development. So initial, this is the general tissue. So initial 2 to 3 years, there is a rapid growth. What physiological changes are there? So during this phase, there is a substantial increase in the body length, weight, and head circumference. Bone grows rapidly, muscle develop, and organ systems expand to support the increased metabolic demands of the growing infant. Then there is a slow growth phase, which is 3 to 10 years. So following the rapid growth phase, there is a period of slower and steady growth that lasts until about the 10 years of age. This is the general tissue. From 2 to about 10 years, there is a slow and steady growth. What physiological changes are there? Growth continues but at a diminished rate. This phase allows for the maturation and fine-tuning of the bodily functions. Bone lengthening continues but at a slower pace, and muscular strength and coordination improve gradually. Then the third is the second rapid growth phase, which is 10 to about 18 to 20 years. Around the age of 10, another significant growth spurts occur, often referred to as the adolescence growth spurt. When there is a rapid increase in growth, the phase is known as growth spurts. We will discuss later. So what physiological changes are there? This period is marked by accelerated growth in height and weight influenced by hormonal changes during puberty. The bones lengthen rapidly and there is an increase in muscle mass and strength. Secondary sexual characteristics develop and organ system continue to mature to adult configuration. What are the secondary sexual characteristics which we will see in the genital tissue? All these phases exhibit the S-shaped curve. You can see here the general tissue and the phases exhibit the S-shaped curve. Clinical implications in dentistry. Timing of interventions. Understanding the general growth curve is critical for timing orthodontic and pediatric dental interventions. For instance, early interventions may be planned during the rapid growth phases for more efficient result. Growth monitoring. Regular monitoring of growth patterns help in early detection of the growth abnormalities and timely interventions. Customized treatment plans. Tailoring treatment plans based on the growth phases can enhance the effectiveness and efficiency of dental care provided to the growing children and adolescents. Coming to the neural tissue. The neural curve specifically describes the growth pattern of the brain, nervous system, and associated structures such as the eyes, upper face, and parts of the skull. The first is early rapid growth phase, which is birth to 6 to 7 years. From birth until about 6 to 7 years of age, the growth of the neural tissue is extremely rapid. Here is the neural tissue, and birth to 6 to 7 years, the growth is extremely rapid. From birth until about 6 to 7 years of age, the growth of the neural tissue is extremely rapid. During this period, the brain and nervous system undergo significant development and maturation. What physiological changes are there? The brain increases substantially in size and complexity. Synaptic connection proliferate, myelination progress, and there is a considerable growth of the cranial vault to accommodate the expanding brain. Approximately 95% of the total increment in size of the central nervous system between birth and 20 years is attained by about 7 years of age. Clinical significance. This phase is crucial for cognitive and sensory development. Any disruption or deficiency in this period can have lasting impacts on neurological functions and overall development. Then the second is a slow growth phase, which is post 6 to 7 years. After the initial rapid growth phase, the growth of the neural tissue slows significantly. Very little growth occurs after 7 years and the neural tissues approach adult size and functionality. So after 6 to 7 there is a slow and it reaches the adult size. What physiological changes are there? While the increase in the size may be minimal, neural networks continue to refine and optimize. Synaptic pruning occurs, which helps in enhancing the efficiency of the neural circuits. Synaptic pruning is a natural process that occurs in the brain primarily during the childhood and adolescence. This process involves the elimination of excess or unused synapses, which are the connection between the neurons. Synaptic pruning helps to streamline neural networks, making them more efficient and effective. Clinical significance. The slowed growth phase allows for the consolidation and fine-tuning of the neural pathways because they remove the unnecessary synapses. Continued cognitive and sensory stimulation is essential during the phase to support the ongoing development and adaptation. Implications in dentistry. Same. Timing of interventions. Understanding the neural growth curve is essential for planning dental and orthodontic interventions, particularly those affecting the cranial and facial structures. Interventions may be more effective when aligned with the rapid growth phase. Monitoring development. Regular monitoring of the neural and craniofacial development can help in early detection of abnormalities and timely interventions to address any issues that may arise. Coming to the genital tissue. The genital curve specifically characterizes the growth of primary and secondary sexual characteristics. First is primary sexual characteristics. These include the ovaries, fallopian tubes, uterus and vagina in the females and the testes, seminal vesicles, prostate and penis in males. Growth pattern. The growth of this tissue is minimal during childhood and experiences a significant increase only at the onset of puberty. Physiological changes. During puberty, these organs undergo rapid growth and maturation. For females, these include in the development and maturation of the reproductive organs, and for males, the growth of the testes and the penis along with the development of the seminal vesicles and prostate. Secondary sexual characteristics. Secondary sex characteristics include the breast development in females, pubic and axillary hair in both sexes, and facial hair and growth of larynx in males. Growth pattern. Similar to the primary characteristics, secondary sexual characteristics show negligible growth until puberty. Physiological changes in females, development of breast and the appearance of pubic and axillary hair. In males, growth of facial hair, deepening of the voice due to the growth of the larynx and the appearance of the pubic and axillary hair. Puberty growth spurts. The genital curve shows a significant growth spurts during the puberty, characterized by the rapid development of both primary and secondary sexual characteristics. This is the genital tissue, and the growth till the puberty is negligible, and after puberty there is a rapid growth. Hormonal influence. The rapid growth is driven by the hormonal changes, particularly the increase in sex hormones such as the estrogen in females and testosterone in males. Achieving adult size. By the end of puberty, typically around 80 to 20 years of the age, the growth of genital tissue reaches its adult size and maturity. Clinical implications in dentistry. Orthodontic and growth assessment. Understanding the genital growth curve is important for comprehensive growth assessment in pediatric and adolescent patients. Timing of treatment. Recognizing the timing of growth spurts can aid in planning orthodontic treatments and interventions for optimal results. Coming to the lymphoid tissue. The lymphoid curve specifically describes the growth of the lymph glands, thymus gland, tonsils, appendix and lymphoid patches of the tissues in the intestine, which play a critical role in the immune system. First is early childhood growth phase, which is birth to 12 years. Lymphoid tissue grow rapidly during the early childhood and late childhood, often reaching nearly 200 of their adult size. You can see here the lymphoid tissue, which is the childhood or early adolescence phase, reaching its 200% of the adult size. Physiological changes. These tissues including the thymus gland, tonsils, lymph nodes, appendix lymphatics and intestinal lymphoid patches expand significantly during this period. This rapid growth is essential for developing a robust immune system, providing children with the increased resistance to infectious disease. Clinical significance: the enlarged lymphoid tissue enhance the child's immunological capabilities, offering better protection against common infections during the early years when children are more vulnerable. The second is a peak growth phase around puberty. Lymphoid tissue continues to be prominent and maintain their heightened size up until the onset of puberty. During this time, this tissue remains significantly larger than in the adults, continuing to support the immune system's development and function. Then there is an involution phase, which is post-puberty to adulthood. By late adolescence, around 18 years of age, lymphoid tissues undergo a process called involution, where they gradually reduce in size to reach the adult proportions. What physiological changes are there? The thymus gland, for instance, shrink significantly and the overall volume of the lymphoid tissue decreases. This reduction is a part of the natural aging process as the body becomes less dependent on the tissues for the immune functions with the maturation of the immune system. Clinical significance: involution reflects the body adaptation to a stable immunological state. However, any deviations from this normal growth pattern can indicate underlying health issues that may require medical attention. Clinical implications: early diagnosis. Understanding the lymphoid growth curve aids in identifying abnormal growth patterns and potential immunological issues in the pediatric patients. Timing of treatment: recognizing the phases of lymphoid growth help in planning dental treatments and interventions, especially those that might be affected by immune functions such as the extraction or surgical procedures. Monitoring development: regular assessment of lymphoid tissue size and function can help in maintaining overall health. Early detection of issues such as chronic infections or autoimmune disorders. These are the references. If you want this PDF or any other PDF, just like, subscribe and comment your mail ID with the topic and I'll send you the PDF. New videos on Thursday evening 6 p.m. and Sunday morning 11 a.m. Also, we try to put MCQs according to topics on our shorts with the answer and explanation if needed, which will help you in Viva or NEET exam. Like, share and subscribe the channel. Thank you.